Do you think, Doctor, that the evolution of COVID has slowed?
I wouldn't say that at all. What we're seeing now is, of course, a diverging pandemic or a dual pandemic. There are parts of the world where vaccination coverage has reached the point where there is a slowdown, certainly of severe cases and people being ill enough to be hospitalized. But there are large parts of the world, and you were just naming a few countries where there are surges, where there's oxygen shortages, where there's a lack of beds and increasing mortality. In the last 24 hours, we've had close to 500,000 new cases being reported and about 9,300 deaths. Now, that's not a pandemic that's slowing down. Yeah. In fact, in 5 of the 6 WHO regions, cases are rising, and mortality in the African continent has gone up by about 30 to 40% in the last 2 weeks.
Yeah. Doctor, have you seen any new variants that could have resulted with, us vaccinating populations whilst cases are going up?
So, there are several reasons for why this is happening. Why are globally cases going up, and why are so many countries seeing a steep rise in cases? And I should add that these include countries that have unvaccinated populations and countries that have vaccinated 30, 40, or 50% of their population. So the reasons are the Delta variant is certainly the most transmissible, the most dangerous variant of the virus that we have seen so far. In fact, the original virus, if one infected person could spread it to 2 or 3 people, this variant, the Delta variant, one infected person can infect 8 people. They're also infectious for longer. So that's the first reason. The second is increased social mixing, what's called pandemic fatigue. People are getting back to their normal lives, either by compulsion because of economic reasons or otherwise. And third is the relaxation of public health and social measures. We've seen many countries and sub-regions and countries dropping all of the measures, including masking and physical distancing. And the fourth is the slow pace of vaccination globally. So these are the things that are contributing to the rise in cases that we're seeing over the last 2 to 3 weeks.
But is it likely that we'll see new variants in the coming months or quarters?
It's quite possible. We cannot predict, but the virus is evolving and mutating all the time. So we're already seeing within the known, like within Alpha and within Delta, we're seeing additional mutations, which can be quite dangerous. They could confer properties where the virus actually becomes even more resistant to vaccines. So, of course, the worst case scenario is that the virus becomes resistant to the existing vaccines, which has not happened so far. There's been some impact on the vaccine efficacy, but most of the vaccines that are being used are still highly efficacious against severe disease. But this is something we cannot predict. So it's really a race between getting our populations covered through vaccination and maintaining the measures till then to prevent the surge in cases. Because we know that the more the transmission that's happening, the more easily the virus can only mutate when it's actively multiplying and transmitting. So that's the way to stop further variants from arising.
Doctor, do we need boosters actually in the fall? And how do developed nations square that with only 10% of the developing nations even having gone through their first shot?
As you rightly said, we at the WHO are focused on trying to get 10% of every country's population vaccinated and protected by the end of September. That's within the next 90 days, and 40% by the end of the year in every country. We don't want to see some countries with, getting close to 70, 80%, and somewhere not even 2%, not even the frontline workers are vaccinated. The need for boosters, depends on the science, and the science, of course, is evolving. What is encouraging is that many studies now are showing that immunity seems to last quite long after a course of vaccination. It seems to last for 8 months. There are some data now up to 12 months where people have been followed up in the vaccine trials. And you have both the antibody responses as well as what we call the cell-mediated or T-cell responses. So it does appear that immunity could be long-lasting and that we may not need a yearly booster. On the other hand, there may be subgroups of people, the elderly, for example, or those who have other underlying diseases, immunosuppressed people who cannot mount a good immune response, who may need more frequent boosters. And there are going to be now studies, I think, happening to look at what happens over a period of time, both in people who do not receive a booster and perhaps in some who do. So again, there's no clear evidence at this point that we're all going to need boosters, which is a very good thing. But right now, the focus is let's get people vaccinated, those who haven't had their first course.
How do you feel about governments actually offering rewards for people to get vaccinated? Is that a slippery slope?
Well, again, it makes me sad because there are countries where people are waiting, are really dying, in fact, are waiting for the vaccines. And there are other countries where people are being given all sorts of incentives and gifts. We're not against that in the sense that you have to do what you need to do to get that vaccine coverage rates up, because that's what's going to reduce transmission, really bring this virus down where it's not having an impact on society. But, we need to understand what's driving either a lack of enthusiasm or hesitancy. In some cases, it's just practical things like, just getting vaccines close to people, making it easier, getting friends or relatives or a helper to come and help you if you're not able to go yourself to the vaccine center, providing that additional bit of information, answering the questions that people might have. In many cases, I think it's those things, and it varies from place to place. It's very contextual. We know that there is vaccine hesitancy, there are conspiracy theories, etc. But in the majority of people, I think they have some questions that need to be answered, and perhaps some incentives, some practical things that make them, come forward. But again, there are large populations that are waiting to get vaccines, and so that's where then we start seeing these inequities.